what divisions are closing at University District versus what is transferring to the Riverbend District Hospital?
So I know people have talked about the hospital closing, and I'm not sure that people recognize or understand what was left at University District. University District is the emergency department. It is a small 9-bed low acuity medical unit, and inside that building, that's really about it. So those are the two primary services that we're looking to transition to Riverbend first, tentatively sometime the beginning of November. That timeline is a little bit up in the air right now, but that's what we're planning for. And then the behavioral health unit is on the campus, but not in that main building. That we intend to keep open. That's a significant financial loss right now, so we're looking for ways to make that sustainable into the future. But as far as our commitment to the community goes, we are committed to the behavioral health unit, keeping that open and until we get a different transition plan. And then we also have an acute inpatient rehab unit that sees about 10 patients a day right now in that building, and that'll transition over to Riverbend sometime in the spring.
Gotcha. One thing that we're also really curious about is that ONA has kind of consistently reported that there's an issue between the nurse to patient ratio. How are you guys kind of anticipating this change to kind of help with that? Do you expect to have any kind of impact on it in general, or is it just kind of a focus on consolidating resources into a more central area?
It's definitely consolidating resources. There is some conversation with the nurse to patient ratio that increased recently here from 1 to 3 to 1 to 4, and the ONA may be referencing the state legislature, the law that went into place or was signed not too long ago, but that doesn't really take place till June of next year. So as far as the state regulations go, we're not too concerned about that in the short term. We have time to look at that and study those impacts.
Gotcha. And so I was able to talk to kind of some students around UO currently, and a lot of them are they're worried about the potential, the difference in access to an emergency room.
Sure.
One of the big reasons is that you have a huge percentage of that population living in the West University District. Having that ER readily available was a huge kind of benefit to them. And then obviously having to drive to Springfield as opposed to just being up down the road wherever they were in relation to the University District Hospital. What would you say to people who are kind of worried or, potentially scared about the fact that, there's a potential an extra 10-minute drive between the University District Hospital to Riverbend? What would you kind of say to kind of help ease those concerns?
Yeah, I think for those patients who are critically ill, they tend to come to Riverbend anyways. Again, this is the hospital where we do surgery, where we have labor and delivery, where we have our specialists, and those services haven't been available at University District for the last 15 years. So there's very limited services there. As far as the emergency department goes, there are other alternatives. I know the University of Oregon has a strong student health center services and other services in the area that will look to work with community members to bolster. But true emergency care for those critical illnesses are typically already being brought to Riverbend anyways.
Gotcha. And then just to kind of elaborate on the whole reason it's being shut down in the first place, you guys, in the press release, it said you guys were at a $2 million loss, $2 million a month loss over the past 15 years, is that correct?
Well, I can't speak that far in the past, but I know over the last several years, it's between a $20 and $25 million loss annually at the university campus. There's also some safety and other care delivery issues that we're trying to fix by consolidating. Right now we can do 1 MRI on the university campus a day. So if you do go to the University District Emergency Department and need an MRI, there's a good chance you're going to be transferred to Riverbend to get it. So those inconveniences, added cost, ambulances runs, those types of things for services that just aren't available there are one thing that we're looking at. Again, we're having difficulty staffing 2 emergency departments right now. And so that ability to consolidate staff and consolidate services in one place also benefits the patients in the long run.
Gotcha. And to that point, you mentioned the emergency staff. Do you have a rough estimation of how many of those staffs are going to just end up at the Riverbend Hospital? I know that there was some talk about there being different options presented to the people at University District, but do you have a rough estimation of how many people from the University District Hospital are going to end up at Riverbend?
We have a hope. We would hope at least 50%, but they just learned about this yesterday, and there's still a lot of emotions that they're processing through, very understandably. And so we'll probably have a better idea over the next few weeks what number of staff are going to transition from University District to Riverbend.
Gotcha. And then kind of my last question, one kind of point of concern we keep hearing is that, with this change, there won't be a readily available emergency room within Eugene. There are people in Southwest Eugene who, they're about as, within just kind of the immediate Eugene-Springfield area, about as far away from Riverbend as you can get. What would you kind of say to those concerns, about the lack of a true emergency room within the Eugene area?
Yeah. Again, the critically ill patients EMS was typically bringing to McKenzie or Riverbend, just again because of the services that we have here. We don't have trauma readily available at University District, mass transfusion, those things that our sick of the sick patients need. End up being delivered here at Riverbend anyways. So the added distance isn't going to make a difference for the routine transports, and for those significantly ill transports, those were coming to Riverbend anyways. So the difference would be, I think, materially small.
Because I know what I was kind of going through this morning was looking at all the services that that University District Hospital and the accompanying medical offices offered. But could you kind of clarify specifically what is being lost with University District Hospital closing down, as opposed to what will still be available with those, what's the exact phrase, the PeaceHealth medical group offices?
Yes. Yeah, when we talk about the University District campus, we're really speaking about the main hospital with the emergency department there on the first floor. The outpatient clinics west of Hilliard that are attached by the Skybridge are not going to be impacted by this.